Hi, I'm Dr. Shilpa. Today, let us discuss about what is the procedure of egg pickup or the oocyte pickup and how it is done. See, oocyte pickup is one of the major procedure during the IVF. That is the most important step, I can say, where we retrieve the oocytes from the woman's ovary, and this is something which I think majority of the women are doubtful as to how it is done and what all is involved in this. So once the stimulation, ovarian stimulation, what we call, with the injections like FSH injections and HMG injections are done, that time we give a trigger shot, and then after 36 hours we schedule the woman for the pickup. So this pickup is done in the IVF OT. There is no need for the patient to get admitted, and this is a short procedure which is done under short general anesthesia lasting for about 10 to 15 minutes. Patient can go home maybe after 2-3 hours depending on the recovery, and she may continue to work in case if she decides to do it after giving a break of like say 6 hours to 8 hours. And there is no change in the diet post egg pickup, and she has to come to the hospital in the morning, say whenever the egg pickup is scheduled, maybe around 1 hour before the scheduled procedure, in empty stomach, and she needs to fast for at least like 6 to 8 hours, and not even water to be taken during this time. This is because the anesthesia will be general anesthesia, and she will start vomiting if she has eaten anything just before the procedure. So once she comes to the clinic, then we take the consent and we give her medications like Emised and Pantodac to prevent vomiting and gastritis, and we take her into the OT. And inside the OT, we put her comfortably onto the OT table, and the anesthesia will be administered by an injection into her hand, and she will be put in the position with her legs up, and using the transvaginal scan we will start doing the procedure of egg pickup. So here we have a specialized needle called the OPO needle, which has a hole in it, and we gently insert this needle into the vagina through which the ovary can be accessed, and we prick the ovary, and we will have a suction machine which creates a vacuum kind of a thing, and the oocytes are sucked out into the test tubes which are connected to the suction tube. So these oocytes are handed over to the embryologist to check for the maturity and also for the quality, and then decided whether to go ahead with the plain fertilization with putting the sperms in the test tube called the IVF, or whether to go ahead with the ICSI, where each sperm is injected into the egg of the woman. So this OPU, once it is completed on that day, so the patient can have liquids or semi-solids, say 3 hours post procedure, and there may be slight bleeding and cramps in the lower abdomen, and patient can walk around. She will be a little groggy, and if she is comfortable, she can start working after 8 hours. No need of any bed rest, no need of admission into the hospital, no need of any saline or IV fluids, and this is a quite simple and straightforward procedure. And sometimes when there are too many eggs and too much of hormones increase, then we will ask them to take medications which will prevent the hyperstimulation of the ovary. But apart from this, we will give them progesterone supplement in case if we have decided to do the embryo transfer in the same cycle, which the clinic will advise. And post procedure, we'll ask them to report or call us up after 24 hours to know the fertilization step, what is the status with regard to the embryos. And then after 3 days, we call from the clinic to tell them as to what is the status of the embryos, what is the quality, how many are there, and all that. And the same call will be made even on the day 5. So this is about egg pickup. I think antibiotic also will be given during this time. I think you have a fair idea now as to what to expect in the egg pickup procedure. Thank you.